we're not affected by it, we don't know about it.
That's true.
So even if we've heard about it, we don't feel it because we haven't experienced it very often.
Okay, now there I am. Okay, let's come over here and we are recording. Okay, thank you, Ms. Black, again for being here with us. I appreciate it very much. And everyone who is here, just a reminder, I'm checking attendance today for sure. And you need to make sure you type your name in the chat box when you're on and type your name when you log off, okay? We are going to have Ms. Andrea Black, who is Mrs. Andrea Black, who is our ULM Title 40 coordinator, Child Welfare Training Program Coordinator. She has been for almost, not quite, but almost 2 decades now, and she has maintained a program that she's telling everybody that I wrote the original grant. That's great, and I appreciate that, but she's the one who's maintained it and been part of the growth of the training efforts for Child Welfare Training Academy, for example, the Louisiana Child Welfare Training Academy, and she'll tell you about that. She's going to inform you about the opportunity of receiving stipends if you're interested in working with Department of Children and Family Services, or social workers and our social work majors, a few of you, and you can ask questions of her and she'll tell you about how to get the applications. She's been a social worker since she was a student of mine. I won't say how long ago that was because she's a lot younger than me, but she's also first lady of her church. That involves a lot of work that is basically Ms. Black like social work. You're doing a lot of stuff for a lot of people. So welcome. Please give her your attention and she'll answer your questions after she does her presentation. Okay. So thank you, Ms. Black.
Thank you, Dr. Savage. And thank you all for the opportunity to introduce the Title 40 Child Welfare Program to you. Uh, just to tell you a little bit about the grant was initially written by our very own Dr. Jennifer Savage, and it is funded by DCFS, which is the Department of Children and Family Services. Um, the reason why we have the grant, it was written to recruit and to train undergraduate social work students such as yourselves for a profession in child welfare and develop them into competent and skilled child welfare social workers. Um, and though very prevalent, you will find that oftentimes the public has very little or no knowledge of child abuse and neglect. And that's mainly because many do not view the indicators as abuse, but as a way of life. And for this reason, many are surprised when it happens or when they hear about a case on the news. Um, so as a result, we have to ensure the preparation of future graduates for competent practice in family services, foster care, child protection, and adoptions. And that is by training and preparing undergraduate students for a career committed to constant betterment of services and protection for children from maltreatment. And expand child-centered, family-focused, and strengths-based child welfare practice methods to support current DCFS employees in continued professional development and to enhance their child welfare skills. And we do this in two ways. We have what's called Families in Focus seminars. We usually hold 2 or 3 of them on campus per year, but due to the pandemic, we were not able to do it this time, but we are looking at doing it virtually, conducting it virtually. And we also have what's called the Louisiana Child Welfare Training Academy. And this um, DCFS allow the students and themselves that get on the Training Academy site to complete trainings. They receive a certificate and CEUs when they finish. So if the agency that you work for provides you with training opportunities that provide you with CEUs, which is continuing education units, that's a win situation, a win-win situation. And that's mainly because conference registration by itself, CSWE, NASW, can cost you as much as $600. And that's not including like your travel, hotel accommodations, and your food. When you finish, you could spend $1,500 or better just on getting CEUs for one conference. And you have to, in order to maintain your license, you have to have 20 CEUs per year, 3 of those being in ethics. So DCFS provides you with all these trainings, and that's their way of investing in you as an employee. There's 7 universities that is a part of this grant, and there's only 7 in the state of Louisiana, and ULM is one of them, and we're very proud of that. Grambling State University, LSU, Northwestern, Southeastern Hammond, Southern University Baton Rouge, and Southern University New Orleans. So there's only 7 universities in the state of Louisiana, while there are other states who have the grant as well, but they're going to be, sort of the same. Only so many universities have that particular grant, and that's because it's very competitive. The recruiting process starts in the spring. You will start seeing sheets up on the sub or just in different buildings where I will post to come by and pick up an application. There will also be on the outside of my door located at Strauss 234. I'm in room 234, Strauss Hall. So you can pick up applications from there. And you can also pick up applications from Miss Brittany in the social work department. We hosted an event called An Evening with Child Welfare. We do this yearly, but this is the first year we were not able to do it due to the virus. That was always a place where I distributed the applications as well. And it was a great event for you, the student, to attend, because we had a local judge to come in and talk to the students on the importance of the role of a social worker in the courts. And also DCFS was available for a panel discussion and a Q&A session. And this allotted you an opportunity to ask any questions that you may have had in regards to DCFS and about the job or about the areas in which you could intern, just whatever you wanted to ask. And also to establish some type of relationships as well. So when you got to the agency, you had already had some established relationships. The requirements, you must have a 2.7 overall GPA and a 3.0 GPA in your social work courses. So, it's, like I say, it's competitive, and we wanted the cream of the crop. You must complete social work 4008, which is child abuse and neglect, and that's mandatory. It's the main reason why we have the grant, is for the prevention of child abuse and neglect. And you must complete 2 additional social work electives, and there's some in psychology, criminal justice, and sociology as well. But I will list those for you. And you have to make a B or better in the social work 4008 and the 2 additional courses that I'm going to list for you. And I'd like to get this information out to you early. In the event you're interested, you can, as you get advice, you can talk to your advisor and say, hey, I'm interested in applying for the Title 40 program. So I need to start taking these classes. So the first is social work 3020, that's case management. 4001, child in the community. 4003, social work with family violence. 4005, differential diagnosis. 4010, human services. Psych 2003, which is child psychology. And 2005, adolescent psychology. CJ 3008, substance abuse. And 4015, juvenile delinquency. And the sociology classes, 4019, the family, and 2003, social problems. So you need to take 2 of these courses along with the social work 4008 course, make a B or better in those 3 courses. After you have met the prerequisites, you will complete and submit your application to me to participate in a screening selection process with DCFS and ULM social work faculty, such as Dr. Savage and myself. We will ask questions of you, and we will grade you on your responses and grade you on a case scenario. And that's so that we could see how good of your critical thinking skills. Once selected, you will complete a block placement with DCFS, and 6 weeks into the placement, you will receive your stipend in the amount of $7,500. And that's your money to do whatever you like to do with it. But it's just an investment that DCFS does in you so that you will go to work for the agency. The last semester of your senior year, you must complete an internship where you will shadow a seasoned social worker 4 days a week, 8 hours a day, for a total of 32 hours throughout the semester, 32 hours per week throughout the semester. So every week you will complete 32 hours in an internship. And that's where you will get to apply everything that you've learned in the classroom. You'll get to apply it out in the field. And you will also have opportunities for teachable moments where, you didn't learn it in the classroom, but in the field. And you will have interaction with the parents and their children. And a lot of times as an intern, you will get information out of the children because they will feel more comfortable talking to you than the actual DCFS worker. So you will be able to establish a rapport with the parents and the children. And you will have exposure to parents who have sexually, physically, and emotionally abused their children and neglected their children. Parents who have failed to provide adequate supervision, parents who have substance abuse issues, and the list can just go on and on. But it is also important that you never present yourself as a social worker out in the field. You must always let them know that you are a student or a social work intern because you don't have that license yet, so you can't present yourself as a social worker. We have 4 slots that are available, and as I said before, they're very competitive. The obligations, you will sign a legal and binding contract with DCFS and ULM, and basically what it does is it explains everybody's duties. The university duty to provide you with the classes that you need, DCFS duties to provide you with the internship, and then you, the student, the duty to make the grades that you need to maintain the stipend. So you will sign a legal and binding contract, and DCFS has up to 2 months after you graduate to offer you a job. Most of the students have been hired in Louisiana, and this grant, because you are interning in Louisiana, you will be hired in Louisiana. I have had some students that ask, well, what if I plan on moving to Texas? If you plan on moving out of the state, then the grant is probably not for you, because Louisiana needs to receive the benefit of, the stipend. So if you accept the job, you're in good standing. You decline the job because maybe you decided, well, child welfare is not for me. I can't do this every day. I can't take this home with me. So I need to look at another population or another area in which I would like to, um, work. So, and if that happens, then you have to pay the stipend back like a regular student loan. They'll set you up payment plans, and you pay it back. But our hopes are that we retain you. You have to work 1 year for the agency because they give you the stipend. But our hopes are that we will retain you as a permanent worker for the agency. And then after working 2 years for the agency, they will assist you with your master's degree. And that's through the Child Welfare Employee MSW Educational Support Program. And what they do is they pay tuition, university related fees, and they give you a book allowance. And this program is available only at GSU, LSU, and SUNO. So those are the three universities that can offer you the educational support for your master's. And if I can leave anything with you, I'd like to let you know that social work is a calling, and you have to have a passion for it. You have to have a desire to want to work with children, want to work with their families, their parents, because we work with them, as a whole. And I became vested in child welfare in one of Dr. Savage's social work courses. She had invited Mrs. Linda Christmas, who was project manager for Family Connections, and that's a foster resource center. And we worked with foster children and their foster parents to keep the children in the placement so that there wouldn't be a disruption. Oftentimes kids do, they go through disruptions where they get in one home and it gets disrupted. And each time they go through a disruption, they lose a piece of themselves. So we try as hard as we can to keep families together. We don't want to, once they get a stable environment, a safe and nurturing environment, we don't want to uproot them and have to place them someplace else. So, and also Miss Christmas spoke very passionately about preventing children from being abused and neglected. And that's kind of what drew me in. She was very passionate when she spoke about protecting children and about the need for more foster parents. And that's what really drew me in. Then later, Dr. Savage wrote a grant for the Family Matters Family Resource Center. And that resource center worked with biological parents. So we worked with the parents on both ends, foster and biological. So we work with the foster parent to help them understand that, okay, this child is here temporarily until the parent get themselves together. And we tried to make the parent and the foster, get the parent and the biological parent and the foster parent to collaborate together, so that they can work together for the best interest of the child. My position at Family Matters is I was a family guide, and I went in and I did intensive services where I was kind of like the legs for DCFS, where maybe they got to go in once a month. I was able to go in weekly and spend 2 to 3 hours, however much time it took to help the parent out. And also put in place a family development technician to also help the parents as well. If I talk to them about maybe discipline and setting limits, and I could send the family development technician in to observe and see if, they were able to do that, as opposed to resorting back to corporal punishment, or to teach them how to cook, clean, grocery shop, because a lot of them were young and they did do like the, frozen pizzas and things like that. And the FDT went in and taught them how to cook beans in the crock pot, and, how to shop and make their food last for the entire month. And they also provided respite, where if they needed to take one child to the doctor, didn't have anyone to watch them, then they would watch that child. They provided transportation to the doctor's office, or, whatever they need, grocery shopping, whatever they need transportation with. And we also went to court as well. We had to testify on the work that we did with the families and whether or not we felt like the children should remain in the home or be removed from the home. And so your job as a social worker is very, very important because we make decisions that are life altering to families. And that's why I say it is a passion. You have to have a calling for it. And anyone have any questions?
Well, this is a quiet group.
Well, I know a lot of us were in class yesterday when you spoke.
Oh, that's right.
Right. Okay. Well,
So
anyone
go ahead.
application, they are on my door, Strauss 234. I have them outside my door, and I have also placed some with Mrs. Brittany. And I did have some people come by on yesterday and picked up, an application. So I'm excited about that. And we have 4 slots, and we need to fill those 4 slots for the new contract year.
Okay. Well, Ms. Black, it's afternoon, and I think we both missed lunch since we've been classes back to back.
Right.
I apologize. I seem to be
No problem.
less enthusiastic than I was earlier. But anyway, this is an excellent program. If you are even inclined, if you were in the previous class yesterday, 3005, and heard Ms. Black's presentation, then you're hearing it again to reinforce. If you have any questions, be aware that when she was telling you about all those classes, those are classes that you choose to take. You don't have to take all of those, right? You just
Right.
2 of those, plus you have to have, well, basically you end up with 3, right?
Right. 3. So short
4008
4008 and the 2 additional courses.
Right. So you end up with 3 courses that are required. One, most people take social work 4008 anyway. And we also like you to know about it because this gives social work students an opportunity to take this class if you even think you might want to apply for that. So you're kind of ahead of the game. Mm-hmm.
Right. And I think it's a good idea that, any student with any major takes 4008. Because as I said before, a lot of people are not aware that child abuse occurs. So I think it would be great for any discipline to have social work 4008.
I agree. And actually, once upon a time when one of child abuse and neglect was one of the first courses I had to teach here when Mr. Ginn was here. Really ancient history. But we used to offer it as a requirement in nursing programs and in allied health. We always had dental therapists or dental hygiene majors take this course too, because it informs you of your legal obligations.
Right.
Mandated reporter.
Exactly.
Explore that again. See what's in the curriculum for those disciplines. Okay. All right. Anything? No questions at all? Okay. From those of y'all who weren't in class yesterday, I guess they all asked them yesterday, Ms. Black. So let you off the hook with this one. So.
Well, thank y'all for the opportunity.
Yeah, thank you. Thank you so much. Appreciate it.
You're welcome.
Okay.
Bye-bye.
All right. Okay, well, we're going to continue for a minute. I'm seeing Miss Emmy's puppy there. Makes me think of my next dog is going to be a burn doodle. Have you heard of burn doodles? Did I tell you all about that before? I know I've seen your pup on
Yes, ma'am.
before. Okay, I did tell you about that. Okay. Yeah, I'm having to save up for it, which I can't speak of like this openly, but my dad's now 11 years old Pomeranian, because it would be rude and very tacky. He'd get his feelings hurt. Okay. So where do we want to start? Let me switch over here for a minute. How are y'all doing on the quiz?
I haven't attempted it yet.
Okay, anybody attempted it?
I have.
Yes,
Oh,
ma'am.
okay.
I attempted it once.
Once.
I have.
Oh, good. Okay. All right. Because I think, didn't I just open it yesterday? Or when did I open it? Finally. You got to remind me because it all starts running together. I'm sure that doesn't happen to y'all. Wait, there's my camera. I'm sure that doesn't happen to y'all with all of your courses, right? And all of your extracurricular and all of your, some of you working and some of you doing all kinds of stuff. So I'm sure you understand. Okay, let me get to our course here for a minute and pull us up and see where we are. Okay, so we're now in Unit 3. As you know, we have our, let's see. Oh, did I put the Zoom link here? I thought I did. Yeah, there it is. So far, that's all you're seeing. But as you can, oh wait, you can't see that. Hold on. Just a reminder, if you join us, you have to sign in for attendance to count, because I don't count if you just sign in and you don't ever sign out, because that means you just signed in, didn't stay with the class, you didn't participate. Speaker view, no. Okay. All right. Do y'all see my screen, or did I just move my Zoom over to my screen 1? Do y'all see the Moodle page or not?
We can see the Moodle page.
Oh, excellent. Very good. Okay. All right. So that's where we're going to start today. So you just had the guest speaker, and now I'm just going to introduce you to, let me move this little bar thing. Oh my, I just lost y'all. Hold on. There we are. Okay, we'll put that back over here. Open that back up, and now you can see it again, correct?
Yes, ma'am.
Okay, thank you, Shirlesha. Okay, all right. So what we're going to cover this time is going into more depth about the different agencies that work with that, but more specifically, this unit's going to be about recognition of symptoms and looking at all 5 of those assessment areas. Remember those assessment areas? Can you tell me what they are? Because all of y'all, I'm assuming, are going to be professionals in some capacity when you finish your degrees for some point in your life. And I would expect that you would need to know that so that you know if you're a mandated reporter, how to rescue children, right? Right? There's my camera. Okay, thank you. All right, so what we're going to go into then is looking at these readings. I've numbered the pages for you because it's going to overwhelm you when you look at it and think, oh my God, there's so much reading. But it's certain parts of it, okay? Certain parts of some chapters I'm going to put up there for you. They're not there yet, as I've been catching up this past weekend and this week so far with making sure I got all the quizzes ready and ready for midterm grading. So you're going to have some handouts on patterns of abuse and neglect. You're going to listen to this podcast about managing child abuse and neglect. And you're also going to have a couple of, physical examination of child sexual abuse. Remember, I promised y'all about that. So if you have any issues with that, then you're going to need to, let me know. And by the way, here's some other things that are probably the worst forms of maltreatment. Let's see, I need to take that out. Okay. Which involved someone that we mentioned earlier in class, which is Andrea Yates. Andrea Yates, as it shows you in what you can see now, but you can't see on your Moodle page yet. You probably won't be able to access all of this until hopefully maybe a good bit of it will be available on Thursday, but I'm sure all of it will not, okay? So we're going to look at all the different forms of maltreatment, as you can see. Let me scroll back up. So we're going to do some of this reading. We're going to look at physical abuse, sexual abuse, recognition of symptoms, traumatic injuries, and how you actually get information from parents and children. And as Ms. Black was talking about, our resource centers that still exist today, but they're under a different administration. They're no longer located at ULM. They're at the Children's Coalition and other similar nonprofits throughout the state now, because it's expanded too, just like the Child Welfare Training Project has. So we're going to look at those 5 assessment areas, and that's what this is really all about: identifying the behaviors of parents that we typically see with maltreatment that helps to confirm a diagnosis of maltreatment, but does it alone confirm suspicion or even a diagnosis of child maltreatment? I need you over here so I can look at y'all. Okay. Does just parents' behavior alone provide enough information about child maltreatment?
No, ma'am.
No, because we have 5 assessment areas, right? So then it's not just parent behavior. What about child behavior? No, not it alone. You have to have those together. And what else? You got to have physical evidence of abuse on the child. There has to be some kind of maltreatment that's evident in the child's physical appearance. So let me qualify that, however, because sometimes those things are not easily seen. And that's what we're going to see with sexual abuse. Sexual abuse is one of those things that sometimes you have to have a pediatric examination. It's referred to Department of Children and Family Services for investigation because you can't see it outwardly. Okay. So parent behavior, child behavior, child's physical condition, the parent-child interaction, remember? And then the last one, what's the last one? 5. What's the last one? 5 assessment areas.
The child's environment.
Yes, their home. And that's why for a time, and still continues, we had services called family preservation and support services. Those were the kinds of projects that I administered, that Ms. Black was telling you I wrote a grant for. Yeah, I did, because I was all about that. I still am actually doing training right now for being a trainer of trainers for family preservation and support. And what that entails is going into the home and basically being a parent coach of sorts. So just like we have coaches for all kinds of sports, this is in the same way, being in the home at times when the parent is most stressed. That might be in the morning when the kids are going off to school, or in the afternoon when the kids are coming home, or it might be meeting with the mother in the middle of the day when the kids are in daycare, or if they have little kids, when she's caring for children throughout the day that are not yet in daycare or in school. And to just basically be present, and to do that for a small number of cases. So our workers, for example, would have, no more than 10 cases, and they were rotating in terms of intensity. So they would have 5 that they would be doing anywhere from 4 to 6 weeks of intensive work with. So they may do, 5 to 10 hours, depending on what the family needs, the parents need in order to keep the child safe, is done up front. And then the remainder of those 10 cases would be cases that they're not seeing any longer in an intensive way for intensive coaching like that. So very small caseloads and very intensive upfront work that gradually tapers off and transitions to other support networks. So that's how that worked in order to try to preserve families. And probably with the case of, Hernandez, the Netflix case, y'all remind me. I always say Hernandez, I think it's Gonzalez.
Gabriel,
yes, Gabriel Fernandez. Oh God, wrong on every count. I apologize. That's embarrassing. Anyway, Gabriel Fernandez. I need to remember that. And being the social worker that I am, I'm horribly afraid that I am offending anyone who is of Latina descendancy. So I don't mean to do that. Okay. So, yeah, so this segment is going to be all about those 5 assessment areas. And so you're going to look at sexual abuse, physical abuse, neglect, and emotional maltreatment. Those are the 4 primary categories. Okay. Within neglect, really all forms of maltreatment categories I've just named that are usually the framework for most literature that you'll see. And again, it depends on the discipline that I've mentioned before on whether or not there's an additional category, like physicians like to put medical neglect or medical abuse, but generally, uniformly, we talk about those 4 areas: the physical, neglect, sexual, and emotional. Okay, so those are the 4 areas that we're working with. And it's such a broad territory in so many ways that children can be maltreated that you have to boil it down in some way to be able to grasp the extent of it, because, it goes from, kind of mild, like, oh, that's not too problematic, to horrific. Okay, so we'll be talking about those cases. I'll be giving you lots of examples of that. And I think I will go ahead and open this one right now so you can see this one. This is a little video. Let's see if it works. I don't know if it will. Ah, okay, I gotta turn it off. I'll fix it. Okay. Y'all pause a minute. I need to answer this. My husband's calling me. It makes me nervous if he calls too much. Whoop. Oh boy. I hate it when that happens. I'm thinking, oh my God, it's something serious I got to pause class for. You know what it was? It's really nice, but still, for class, please. He wants to take my car to get the oil changed. So he's passing by campus. Anyway, that's a nice thing, but hold on, I forgot I got to do this. Hold on. Now I have to give him the key. All right. So, okay, there we go. All right, now, so you're gonna also, this one I really like, and obviously this one still works. Yes, okay. So this one still works. This is about various things that occur worldwide. Lots of just atrocities that go on with other countries and populations everywhere, from genital mutilation for some cultures and soldiers, particularly like in Darfur, when they were really warring intently, or Rwanda, that some of the warring tribes would actually use female genital mutilation, FDG, that they would rape the women as an act of war, and sometimes would kill them because of the nature of the rape being so violent, and so violent such that there's an organization that Eve Ensler, who was the creator of a program, actually a Broadway play, that she put into or turned into an international nonprofit organization to advocate for women's rights around the world, not only in the United States, but around the world, every country. And every year she does the she does a program, a whole day conference thing where she brings people in from whatever country she's focusing on with her nonprofit. But she was the creator originally of the vagina monologues. Have any of y'all heard of the vagina monologues?
I've heard of it.
Jasmine, you said no?
I said I have heard of it.
You have, okay. Anybody not heard of it? Tell them what it is, Jasmine. Okay, my husband stops
I'm
it.
not sure what it is, but I think ULM usually hosts the vagina monologues. I know that because they usually advertise it.
Right, exactly right. It's a Broadway play that has been taken on the road, and it's also available for women's student groups to take the script, which is provided free, and can use that script to actually produce on their own campuses the play. And ULM, I'm proud to say, does it. My previous university, Jacksonville State, was just starting with the vagina monologues, and I got to actually do a part, so it was kind of fun to be involved at that ground level. And especially because Eve Ensler has, like I said, she focuses on different world events that are going on. And at the time I joined Jacksonville State University in Alabama, Jacksonville, Alabama, not Florida, she was spotlighting with her annual conference the Katrina victims, and particularly those from New Orleans. But she took everybody from the coast who were involved in the devastation that occurred from Hurricane Katrina and then Rita right after. And of course, New Orleans had the flooding on top of that was caused by the hurricane, but was actually even a separate catastrophe on top of that. And just really remarkable. And then another year, the reason I brought her up is that she did focus on Darfur and also Rwanda, but specifically Darfur, because they were at that time, I was still at Jacksonville, I didn't leave there till 2016. So it was like, I don't know, probably 2010. And at that time, female genital mutilation, I put a D in there a minute ago, I wasn't supposed to do that. Female genital mutilation was really getting a lot of attention in media with this, the atrocities that were going on over there. And so I was able to see a production that at her conference that Eve Ensler produced with several others. There he is. Where's your key?
You're gonna need a sticker. I don't know what to tell you because I can't switch it without the key. So
Were you gonna bring it back up to me?
I gotta do 2 trips.
Well, I'm in class.
I know, just.
Oh,
Where's the sticker?
Just go.
Just got a sticker.
It's in the car. Go. It's okay. I got it. I'm smiling. It's a nice thing. I have to be nice. I have to be happy. You have to be happy. I'm happy. I'm happy. Okay. So anyway, I was just telling you about Eve Ensler having this stuff about female genital mutilation, and what is really amazing. What? Oh, wait a minute. I just bumped into my printer. Is that these women that survived the rapes that were occurring as acts of war were sometimes elderly women who were elderly when they had been raped and were not able to hold their urine or their feces in some cases. So all age women were vulnerable to rape as an act of war and were suffering female genital mutilation. But then there's also a cultural trend. There's a really good film. It's a little bit dated now, but it's called Desert Flower. And I think I once, when I first heard about it, it was already a couple years old, I think. And it, I had gotten it off of the, what is that, Redbox, I think, where you go up and you can rent the disc, whatever. Anyway, that was in Jacksonville. And I'm not sure if you can get it on one of the streaming videos or not. I would guess you might could, but it's called Desert Flower. And in it, the woman who is, I'm not sure where she's from. She may have been from Ethiopia. I'm not 100%, but she's from one of those underdeveloped South African countries, because not all of them are underdeveloped. But she was culturally had female genital mutilation because that was expected of proper girls of her culture. And so she had been sewn up, but was recognized as someone who had potential as a model. So she ended up coming to the United States as a model. You just have to see the whole story. But what we know about genital mutilation as a cultural norm is that if it's not an act of war, that's a whole other thing. But as a cultural norm, what happens depends on the culture we're talking about, but one that's really pretty hard for us as Americans, as Westerners to understand, is that the cultural norm of having your uterus basically sewn except for just a small little opening. So that would happen before puberty. So once you entered puberty, there wasn't much room for discharge of your menses, your period, in other words. When that culture married, the bride, not the bridegroom, but the best man would have sex with the girl to break open that little bitty sewn up vagina and prepare her for her groom. So cultural norms we have to be real careful about, because they show up in all forms of maltreatment, which we'll see. So for example, in physical examination, wait a minute. Well, let's start with sexual abuse, since I'm pointing to it, even though you can't see it right now. I need to verify that everything's okay and get your assignments up too. If a gynecologist sees an immigrant group that where a child is examined on a pediatric examination, and you see that little bitty opening where there has been genital mutilation, actually, it's not only sewing up the vagina, it's removing the clitoris, because the woman is not supposed to, in the particular culture I'm talking about, I apologize, I can't remember which country it is at the moment, but to achieve sexual pleasure is not thought to be proper for women. So if a child who's had that done is seen by the pediatrician because she's having problems in that area of her body around her vaginal area, maybe she's starting a period early, then they may see that if not informed about female genital mutilation, which physicians are. But if they were not informed, then they might think that that was abuse that occurred in the United States. Actually, it is illegal in the United States, even if you immigrate here and you still try to engage in that. That does happen. And by the way, some Middle Eastern countries also have hit the news media with killing their own daughters because they don't comply with the Middle Eastern cultural norms of obedience to your parents, specifically your father. If he tells you who to date, who to marry, that's what you're supposed to do. Infamous case, probably also when I was in Jacksonville, so that was sometime between 2012 and 2016, where a father sought out his daughter, who was very obstinate, and went to the mall with her girlfriends anyway. They had immigrated here to the United States. She didn't want to wear the hijab, and he sought her out because he'd had just enough and ran over and killed her at the mall in front of everybody. So, obviously we have to respect cultural norms, but at the same time, when someone comes to the United States, we have to recognize that they have an obligation as an immigrant to assimilate into our culture, to accommodate, I should say, into our culture. At the very least, accommodation means that you're able to be in your own culture as well as in the new culture. Assimilation is when you become totally a part of the new culture.
Miss Savage.
In that particular case, was totally assimilated, we could say, or wanting to be totally assimilated as a teenager, whereas her father was not.
Dr. Savage.
Yes.
doesn't like cultural relativism mean like you can respect that people have like their own cultural norms, but you can also like recognize the fact that some things are like inhumane? Like I understand that like in third world countries, women are like treated badly, but even if it's like a cultural norm, that's still not okay.
No, it's not okay. And there are, and I'm always tuning in when I hear as a social worker, especially news programs. And there's been one even this year, I think, on the public broadcasting system, PBS News Hour. I like to watch their News Hour every once in a while. And because they do international stuff too. And there was something recently about a group that's seeking actively, a group of female gynecologists in one of those countries that's actively seeking to eliminate that practice, to educate people about it being inhumane. But when it starts as a cultural norm, you're right about cultural relativism, Shalisha, but that norm takes a long time to change, and is very difficult to change. I mean, think about what we're dealing with COVID and asserting our rights to not be told by the government what we should do with wearing masks or not. That whole thing is based on the norm in American culture that we have independence and freedoms, and don't abide well when the government puts out an edict for us, even if it's for our own good, right?
Yeah, like I probably should have used like the example of like child marriage, because I know that some people say we need to like mind our own business, but then again, that's not okay.
Right. Yeah, no, it's not okay. And that is another issue. Oh, Lord have mercy. You know what? I think we need to just call class. I don't know why I'm having all these interruptions, but that's another issue. I'll call her back. I don't know how to turn it down. That's sad. Oh, wait. Okay. So that's another issue that you're just absolutely right, Shalisha. I'm trying to find my way back to the point before I got distracted with the phone ringing. Is that the cultural relativism, that's where we started out, that it is inhumane. Groups are trying around the world, different world organizations. I know my daughter-in-law is a pediatrician and finished her medical degree with a classmate who's also a good friend in college that became part of the Doctors Without Borders. I forget the French, Médecins something, I don't know, but it's Doctors Without Borders in English. And she trained as a gynecologist after medical school and then joined Doctors Without Borders. And so she has passed on to my daughter-in-law some of the places she's been. Somalia and is one of them that she's been at too, that they're actively working to try to educate people, but it takes a long time. It sure does. Takes a long time. And whereas mask example in the United States as a norm of independence is not a good comparison, because not wearing a mask is not necessarily inhumane, unless you want to get to the fine point of there may be inhumanity on the part of the protesting, the person protesting wearing masks, when they may be risking or have risked exposure, maybe unknowingly, to others who may have died among that 500 million plus now, even with vaccines, So anyway, I think that gets to what you were talking about, Shalisha, I hope. Anyway. Okay, so sexual abuse, certainly with physical abuse, we have to be careful. There's also a cultural norm there, and we'll just go ahead and finish covering that to be aware as we go through these. I won't have to spend a lot of time or get distracted talking about the influence of cultural norms. So in physical abuse, for example, we have an Asian custom. I know it's prevalent in Vietnam, and I know that because of my father, who's been passed now for a few years, and whose dog I've inherited when he passed about, 3 years ago. Anyway, he served in Vietnam, and he told about this, that there would be little children that would come up to the soldiers, and I'm sure still do in Afghanistan and all of the places where we have our soldiers now, including still some in Iraq. And so anyway, he would tell about these kids that would come up, and of course they wouldn't be, you know, they wouldn't have shirts on or whatever, and their backs looked like they were just beat. But what it is a technique of healing where some Asian cultures, and again, I just happen to know about Vietnamese culture because of my father, and also having that reinforced with being educated about child abuse symptom recognition, that they would take metal coins and they would heat them up, and they would take those metal coins and strike and scrape them along their backs, and in a striated pattern. They would go down, and then they would go this way, and then they go down and up and down and up. And it looked like a lashing, right? But that is a cultural norm for them to heal, to draw out the humors, if you will. Really anachronistic understanding of physiology today. Similarly, a practice in some Asian cultures again, but also a few, I want to say Guatemala. I've heard this associated with some Guatemalan practices culturally, where they'll take a glass cup, you know, and they will, but usually it'll be it could be any kind of cup, but they'll heat the cup up, you know, and then they'll put that on the body of the child in different places, and that's called cupping. And that cupping is what looks like deliberate abuse, like something's been used to inflict the imprint of the thing to abuse the child. But you have to be careful about that. That's not recognized as something other than a cultural norm if you're seeing a group like an Asian family that's been reported because maybe daycare's seen this, right? So if you were an investigator, you were working DCFS like Ms. Black's talked about earlier today, then you would think about that, right? Because that'd be part of your knowledge base about Asian cultures. And you might ask about, is cupping a practice that your family uses for healing, you know? And you would hopefully do it a lot more tactfully than that, but you could have them explain the injuries. And if they talked about cupping, then you could acknowledge that you understand that. But just like Charlize was saying, that's not necessarily inhumane unless you saw it, say he's trying to heal, you know, a child's genital area. That would not be appropriate. But if you saw it in an area that's on their primary soft tissue area, like on their chest for healing colds or flu or fluid, trying to get fluid moving in the chest area. That's most common where I've heard it being used. So that's a cultural norm that you have to be aware of too. Another is, and this is more genetic, not behavioral, but it does manifest as a physical example of bruising, and that's called Mongolian spots. People of Asian, Italian, African, Caribbean cultures, that they may manifest these, look like bruising on their bodies. And what they are Mongolian spots. It's a genetic thing that goes with some of those cultures. So that has to be recognized as not abuse in and of itself. Investigated, sure, but expect it to be dispelled, probably, likely. And there are other manifestations that we're going to learn in this unit about how you can recognize how injuries manifest to also distinguish them from cultural norms. Okay. Emotional maltreatment, a cultural norm, might be among Chinese culture in particular. I don't know if y'all are old enough to know about the tiger moms. Anybody?
I've heard of them.
Tiger moms. Charlize, were you saying you had?
Yes, ma'am, I've heard of it.
Yeah. Well, there's a woman who wrote a book about, you know, Tiger Mom, And she basically was justifying what we might consider in widespread Western culture, all the rest of us who aren't Chinese, and see that as a cultural norm, as emotional maltreatment, notably verbal abuse and restrictive environment, meaning that they're mandated to study all the time, they're pushed all the time, you know, to do well in school, to do well behaviorally, to be meek, to be withdrawn, to not, or to appear withdrawn, to not be outwardly demonstrative, you know. In our Western culture, you know, all of those things are okay. We expect that with normal child development, right? But not so with Chinese parents necessarily, even those who have been Americanized such that they're second or even third generation. So she wrote this book about Tiger Mom, that Tiger moms really do assert their authority over their child, that they really are those authoritarian, there I go again, they really are those disciplinarian parents. I'm going to get that straight in my lifetime yet. Again, might be a cultural norm, might not be emotional maltreatment. So we will have covered some of that material for here today, at least with all of our distractions, and hopefully won't have those on Thursday. On Thursday, I will go over the quiz. Let me see, I did put it up here in, oh, I thought I put it in 3, didn't I?
Dr. Samet,
Yes.
I believe Thursday is a War Hard Day off.
It is.
Oh, it is. It sure is. It sure is. Okay, well, we don't have class on Thursday. Well, what do you know? There's quiz 1. I need to move it up here so you don't have to go searching for it down there. I don't have a header for it yet, but I'll put it up there. Okay. All right. Well, then on Tuesday, we'll look at it. Okay. And I will leave it open through that day so you can go back and get the feedback that some of y'all have requested. I don't think any of you've seen feedback, have you, when you've taken it, if you've taken it? Is that, no? Anybody taken it, seen any feedback?
The last time I looked at it, I didn't see any feedback.
Yeah, well, I was telling my class at 11 o'clock that I struggle with Moodle trying to get it just right to make the feedback pop up after you get the wrong answer, for example. I have yet to figure it out. And I've even been to Moodle trainings here on campus, for real. So I don't know how to do that. And the only way I know to do it is to reinforce, which I do anyway with reviewing the quizzes. That's part of the design of having them open-ended so that you have to search for the answers, hopefully, and then you repeatedly take it to reinforce the answers you get, and then to actually give you the correct answers. I want you to get all 50 points. So if you're here that day that we review next Tuesday, then you will still have an opportunity to go back in and get all 50 points if you haven't yet. It's also a good opportunity that I like, because if there is an error I made on writing the quizzes, each time I do a quiz, I'm always looking at it, trying to correct it, or ones that, you know, were errors in the past. I always try to also tailor it to what we actually are able to cover at the time of quizzes. So I'm always rewriting and revising. And sometimes I make mistakes, and that way it prevents you from getting all 50 points, which I want you to get, right? So by going over it, then you can be sure that you're going to get your 50 points if you've gotten all but one, and it was that one that I made an error on, you see. But then it also mostly reinforces the content. Okay, so we'll be doing that on Tuesday. Okay, well, great. I got a free day free for y'all, but not so free for me, but free in the sense that I can get all this cleaned up for you and open, so we're ready to go Tuesday. Okay. And I'm just going to quit because so many interruptions. I got to answer this phone call. I think I know what it's about, so I'm kind of concerned. So yeah, about family, it's about work. But anyhow, any questions? No? Be sure you can get your attendance. Remember, I don't give you credit if you don't sign in and sign out. Those were suggestions from students. So that's what we're doing. Well, I'll stick around, so if you have a question you want to ask me, you can.